Welcome to the deep dive. So today we're opening up the files on a really key health check, the vitamin B12 blood test. Our main source here is some great research compiled by Blood Test UK, and it really maps out what this test is and why it's such a powerful tool for you.
It really is.
So our mission today is to get you up to speed on what it is, its benefits, and maybe why spotting a problem isn't quite as simple as you might think.
Absolutely. It's a vital tool in our clinics here in the UK. A simple test that checks the level of this really crucial nutrient.
Crucial for what, exactly?
For making healthy blood cells and, really importantly, for your nerves. Finding low levels early on helps doctors get in there before things get serious.
So we're talking about things like anemia.
Anemia, yes, but also preventing potentially long-term neurological damage.
Okay, so let's connect that to convenience. Blood Test UK highlights how local facilities, say in a place like Bolton, make this whole process much easier.
Yeah, and that's a huge point. It's all about accessibility.
How so?
Well, the test itself is just a quick blood draw, nothing complex. So it can be offered really affordably and easily right across the NHS.
So you could just pop into a local clinic.
Exactly. And the source stresses the rapid result turnaround. That speed is so important when you're dealing with symptoms that could point to something serious.
Right.
That convenience, being nearby, the speed, it's all part of making healthcare work for people.
That makes sense. But if the stakes are so high, anemia, nerve damage, why isn't everyone just getting tested constantly?
That's the real challenge here.
The research from Blood Test UK mentions certain groups are at a higher risk.
Yes, and that's because the deficiency is a bit of a diagnostic chameleon. It often just shows up as general tiredness or maybe some memory fog.
Things you could easily brush off as just stress or getting older.
Precisely. So this test is so important for older adults who tend to absorb B12 less efficiently, and also for vegetarians and vegans.
Because they're not getting it from their diet.
Right, they're not eating the primary sources. So for these groups, regular screening, maybe every couple of years, is about prevention. It's about stopping that decline before it becomes really hard to fix.
And we absolutely have to mention pregnant women. The stakes there feel even higher.
Oh, massively. Monitoring B12 during pregnancy is essential. The research is clear that having enough B12 helps prevent really serious complications.
Such as?
Things like congenital disabilities or developmental delays in the baby. It's a tiny test for a huge healthy outcome.
Okay, so for anyone getting ready to take the test, preparation is key. The advice from Blood Test UK seems a little contradictory though. Fasting or avoiding supplements? Which one is it?
Yeah, that's a great question. It can be confusing. You definitely don't want a supplement skewing the results.
And how do you know what to do?
It really depends on what your doctor's trying to find out. If they want to know your baseline level just from your diet, you'd stop supplements for a few days. But if they want to check how your body is absorbing it overall, they might ask you to fast. The key thing is to talk to your doctor. Tell them about any medications you're on.
Right, so communication is everything.
It is. And, for just keeping your levels healthy in general, it's about eating things like meat, fish, eggs, and dairy.
So this deep dive really shows the vitamin B12 test is a simple, very convenient tool, especially here in the UK, to stay ahead of some serious health problems.
It is. And if we bring it all together, the source reminds us that those symptoms, tiredness, brain fog, are often dismissed because they look like so many other things. Thyroid issues, stress, you name it. And that leaves us with a really important question for you to think about. If these simple everyday symptoms can hide something this significant, when should you push your healthcare provider for a proper check, including B12, instead of just accepting that you're tired?